Hi, Christina. How are you?
Hi, Tatiana. I'm doing well. Thank you. How are you?
Good. I'm so excited to hear about your procedure. You had something called a tip stitch procedure, and you're going to tell us all about it. So thank you for coming and speaking with New Beauty.
I am so excited to be here and so excited to be talking about this new technique coined by Dr. Bassiri.
Is it a non-surgical nose job?
Yes, so it's minimally invasive. I never hated my nose, but I didn't love it. I had a little bit of a droopy nose, especially on one side of my face. So whenever I saw pictures of myself or did Zooms or a selfie or whatever it may be, there were certain angles where I just hated my profile. I just did not like it. So it just seems like a procedure that was perfect for it was exactly what I was looking for.
Had you considered a rhinoplasty in the past?
I have was a little nervous to go under the knife, truthfully.
Yeah.
I've done all of kind of like the non-invasive treatments like fillers and Botox and lasers. So I was looking for, I have even tried like a liquid rhino, but I know those can be very dangerous. They're not necessarily FDA approved. So I was looking for something that was a little bit less invasive.
And then can you explain to me exactly what goes into a tip stitch procedure?
Yes. So Dr. Bassiri is going to do a much better job than I am. But from a patient standpoint, what he did is he made a little incision in the septum as if you were getting like a septum piercing,
Hmm.
put a blue permanent thread through it, and then he gently lifts it to just give the tip of your nose a little bit of a lift. And then he kind of like ties the knot and hides the thread. And it's a permanent stitch. So it'll last about like 5 to 10 years.
Wow. So
Yeah.
it's not like filler that you'll have to come in a certain amount of months to get redone. And like you said, a filler in the nose, that's a kind of a danger zone because it could lead to vascular occlusion and nobody wants blindness.
100%. I think I've done the liquid rhino. I loved the way it looked. So I knew kind of the look I was going for. I just wanted to be safe about it. And again, I just wasn't ready to go under the knife. I just had a baby. It was a C-section. So I had just kind of gone through like that whole process of like recovering. And I just did not see myself like being in bedridden for a week or like super bruised and everything. So when he said he's just going to use a little numbing cream and a numbing injection, I was like, sign me up.
So you just had this done last week or 2 weeks ago?
No, exactly a week to the day.
1 week ago.
Yeah, of
Wow. And can you walk me through that day, what the procedure was like and how recovery has been?
course. So I ran in chaotically, per usual. And Dr. Basiri right away, we took my before pictures. We kind of went through the procedure again, signed all of the consent forms. And then right away, he put some numbing cream in. And I was just icing my nose for a little. He really wanted to make sure that the numbing injection wasn't going to be too painful because he is very considerate. And I think I was like so nervous about the pain part. I just was a little traumatized in the C-section. So I was like, the pain. So we did the numbing cream, we did the numbing injection. And then truthfully, like the pain level was like, I don't know, maybe like 4 to 10. It wasn't even once the injection kicks in, you don't feel anything. It just feels like, uncomfortable because he's like doing stuff to your nose. But he did lay some like cotton things over my face. So I didn't have to like watch exactly what he was doing.
Well, it's good that you've had a filler procedure. How does it compare one versus the other?
Well, this was in my nose versus like the liquid is
Right.
kind of like they're going out. This was like it's in your nostrils. So again, just like a little uncomfortable,
A
but no,
little bit more invasive.
yes,
Yeah.
I would
And
say
then, and what did you notice the result right away? Tell me about
yeah. Yes. Oh my God. So right after we had, Dr. Basiri, we had like the assistants in the room. So as he was like pulling the thread to lift it, like the people in the room were like, oh my God, that's making a difference. Like we were giving live feedback.
Wow.
And then as soon as he was done, he sat me up and like handed me a mirror and you can see a difference. So yeah, it was pretty immediate. Of course, he like bandaged me up and everything before he sent me home, but we were able to see immediate results, which I love because I have zero patience.
And you're smiling from ear to ear. So I'm assuming you're really happy with your results.
I am really happy. And if I do have to do this again in 5 to 10 years, I'm like, sign me up. Like I was in and out in like 45 minutes.
Where do you see the biggest difference?
My profile. So from straight on, same nose, but profile definitely like a nice little lift.
Yeah. And, after pregnancy, they always say your nose changes.
A
And
lot
I
of
think
things.
a lot of change. But I think that's one of the first things that I noticed was my nose was a little droopier.
Yes.
Yeah.
Dr. Bassiri will talk more about it, but as you age, your, like the skin elasticity reduces. And that is like one area that tends to go down. So again, if I have to do this in 5 to 10 years, I'm all in.
And then tell me about recovery. So day 1, day 2, day 3, and here you are a week later. How did it go?
Day 1, I popped some Tylenol when I got home, and that was the only time I took anything. I wore a bandage on my nose for a few days, and that was really it. No pain meds, nothing really, no bruising, just a little swelling, if anything, the next day, but zero bruising.
So immediately back, no lifestyle changes, no need to take time off.
No, I took time off the gym for 2 days. I just didn't want to
Okay.
be like bouncing and like hit it by accident. But I got it on Thursday, and I think Sunday I went to the gym.
Amazing. Such a quick and easy procedure. So I can't wait to talk to Dr. Bassiri about it and learn a little bit more. So thank you so much for bringing your story to us and sharing it with us.
Of course. Thank you so much for taking the time to chat and for covering this exciting new procedure.
Hi, Dr. Bassiri. How are you?
I am great. Thank you for having me.
Thank you for speaking with NewBeauty about your TipStich procedure. I have to say, I've never heard of it before, and I consider myself a little bit of an expert on procedures and treatments. So I'm excited to hear about it. Christina looks beautiful.
Thank you.
Can you walk us through the procedure and explain a little bit about it to our followers?
Sure. So basically what I've realized over time, there aren't too many great options for like a non-surgical or not super non-invasive rhinoplasty. So fillers have their risks of skin damage and even blindness. And then some people are even doing thread lifts for the nose, which is, I think, even another problem. And I've taken those out on patients. What I started to do is a rhinoplasty maneuver that I do in surgery to support up the nasal tip, but applying it in a minimally invasive way in the office under local anesthesia. So it's very good for patients who've lost support in their nasal tip and it's just drooping, maybe patients who've had surgery, maybe patients who've aged, certainly patients who are smiling and the tip pulls down. If that's their main concern, then this is something that I think would work well for them. And they don't have to go through the whole entire rhinoplasty and change the entire shape of their nose, and certainly don't have to go through anesthesia. So the recovery is much faster, just some tape for a couple of days. But essentially, it is a surgical procedure done through very small incisions on the inside of the nose. And similar to rhinoplasty proper, I am releasing some tissue and releasing some support in order to reposition it either higher, more forward, slightly farther back. And then I secure that with some sutures. So it's cartilage to cartilage. So it's not just pulling on skin. So you have longer lasting support. And those stitches are all hidden internally and are long lasting, which are meant to provide long results. Also, as the process heals, there's some internal scar tissue, which any healing is going to have that will further secure everything up.
Now, when you're stitching up, I don't know how to say it properly, but stitching the tip, are you making any accommodations for the person's or the patient's unique anatomy while you're doing it? Or is it just a similar technique for everybody?
So certainly there are adjustments for sure. The idea is very much the same. We're really just supporting it up. So certain patients, in order to get that up and have it sit in the right place, may need a little more release of tissue, maybe higher up, where to accommodate the tip moving up. Some patients don't need as much, but certainly every patient I have I'm taking photographs of them before, and I'm taking photographs of them smiling and seeing where the apex of the hang is so that I can choose the right vector in which to pull it up. It's not the same for everyone, and everyone has different needs and everyone has different limitations. Overdoing it may over pull the nose to a little higher than you want. But because, again, we're not doing as like a huge open rhinoplasty, the risk of it going too far up is mitigated, essentially.
Right. And then Christina was explaining that the results, you can expect them to last from 5 to 10 years. So would this be something you'd have to come and get done again later on?
So it's, first off, with any surgical procedure, there's some swelling and some changes right away. So on the table, on the chair, we do this in the clinic, there might be a little slight overcorrection that can drop a little bit as the swelling comes down. It is a surgical procedure. So even though it's done through small incisions, we are expecting surgical results that'll last. Should the tip drop over time, it's just like any other surgery. There could be changes in the nose for many years after the fact. So it's not fully predictable, but should it drop, it can be done again. Should there not be enough of a change, we're certainly not burning any bridges down with this technique. You can still go and perform a regular closed rhinoplasty or open rhinoplasty without really losing anything, which isn't necessarily the case with fillers. So you put fillers in the nasal tip, you have all the risks to deal with and complications. And when you go back in, it's not the same. And thread lifts, which goes just beneath the skin, really can alter the anatomy and cause real healing problems. So with those other techniques, you're limiting yourself for future surgery. With this one, really, like some of the things that can happen would be maybe it didn't do as much as you want, or maybe someone's scared to have a bigger procedure and this kind of gets their foot in the door and ultimately they want more changes that they didn't think they wanted. Certainly can be done. And you don't have to necessarily even wait for the full year to do the revision, especially because there might be other parts of the nose.
So who would be I think you kind of touched on it a little bit, but just to go over it again, who would be a great candidate for a TipStich and who just, it's not for them?
Yeah. So the kind of simple rule of just seeing in the mirror would be anyone who kind of doing this in the mirror and lifting their tip up and like, oh, I just wish it would just stay up there a little bit. And I like everything else about it. That's a great start. Now, who is that? Usually it's people who are older. As we age, we lose some support on the nasal tip. Some patients just never have a lot of support in the nasal tip. So when they smile, it droops down and hooks a little bit. Also, patients who've had septoplasty surgery, so not even cosmetic surgery, the incisions that go in to access the nose can destabilize the tip. And over time, that can cause the tip to weaken and you lose support. So the nose is kind of, if you boop it, it'll squish in. And if it's a very squishy tip, then you may have some room for support. So it's pretty straightforward as far as figuring out who needs it. And then I have some things that I look at myself to make sure they're a good candidate.
I'm going to go home and do this a lot in the mirror now. But if you have like a hump, a dorsal hump, something like that, this would
So this is not touching that area at all. However,
right.
I will say this, I think it's been a popular procedure for men for good reason. I think a lot of male rhinoplasty can be overdone because people go in and they feel like surgeons go in, they feel like maybe I have to do such X, Y, Z because I'm doing a rhinoplasty. Let me do the rhinoplasty. But I think there is room for men to have a larger profile or stronger profile on the dorsum. And I think that they don't necessarily need to have, they can even have a bump and they'll be happy with it. So it's the hooking that makes it look older in male patients and a little like snarling and almost angry in certain ways. So getting this up presents like a more friendly kind of appearance to the nose, and the downtime is extremely low. So especially in male patients who may feel uncomfortable to undergo a rhinoplasty with the tape and the downtime, and they have like a busy work schedule or this busy exercise schedule and they don't want to take time off for that. I mean, women as well, but men might be okay with having a larger hump present even after this.
Wonderful. Well, thank you both so much. This has been really fascinating and I'm excited to see the TipStich take off. You heard it here first. NewBeauty. Thank you both.
All right. Thank you again.
Have a great one.
Okay. Bye.